And new this morning, state business leaders and medical officials share their thoughts on the current COVID surge. Indiana Chamber of Commerce and the Indiana Hospital Association gathered on Zoom around 10 this morning. Officials discussed the surge impact on hospitals and workplaces. Indiana Chamber of Commerce President and CEO Kevin Bringar spoke the major impact the surge is having on the local workforce.
It has become increasingly clear that a vaccinated workforce is absolutely essential to Indiana's future economic health. Many Hoosier businesses can't afford to have another COVID outbreak or temporarily close. I spoke to the CEO of a telecommunications and technology company earlier this week who has retail stores all across Indiana. He told me that they had so many staff out in quarantine or in the hospital with COVID that they were struggling to keep the stores open, which without that means they can't serve their customers and obviously has significant impact on their revenues. Manufacturers that I've spoken to have talked about how they've had to cut down production because so many employees are out with COVID, and they're having supply problems because their suppliers are experiencing the same thing. And this is contributing to the supply chain problems that we're all aware of and have heard.
Now, more than a year after the vaccine rolled out, the average daily case rate is more than 265,000. That is higher than at any point during the pandemic. At the beginning of the year, there was 250,000 daily cases on average, according to Johns Hopkins University. Hospitalizations are half of what they were during the last record run. The CDC is predicting hospitalizations and deaths will keep rising. Its latest forecast shows more than 44,000 people could die in the next 4 weeks. As cases keep rising, Indiana officials are asking people to do their part and get the COVID vaccine as Omicron makes its way to Indiana. News 8's Adam Pinsker explains why health officials are concerned.
Governor Eric Holcomb frustrated over Indiana's lagging vaccination rate in his first press conference on COVID-19 in several months.
For the life of me, I struggle to think about how some folks trust certainly the most lethal virus that anyone living today has been most anyone who's living today has been exposed to.
The state's health commissioner, Dr. Christina Box, says COVID-19 cases are increasing dramatically in people 40 and under, as well as children 9 and under.
School cases have also increased before the winter break to some of the highest levels that we have seen in months. As a result, our positivity rate is once again hovering around 14% after falling to 6% in October.
The health department says only about half of eligible Hoosiers are vaccinated, and among that number, only a third of them received the COVID-19 booster. COVID-19 testing kits remain in short supply as cases surge.
I was at a CVS yesterday buying toothpaste, another confession, in the morning, and the clerk that was checking me out took multiple phone calls while I was standing there and had to say that, no, they did not have tests available at this time.
Dr. Box says she fears vaccine hesitancy and increased patient loads at hospitals will cause healthcare workers to burn out.
We have lost a tremendous number of healthcare providers. Someone very close to us just told us his wife is leaving an emergency room setting because she just can't do it anymore. And quite honestly, we will continue to lose more nurses and respiratory therapists and physicians from the healthcare profession.
I'm Adam Pinsker for Wish TV, wishtv.com, and follow us on Facebook.
The governor extended his emergency health order until February 1st, which has been in effect since the start of the pandemic. This will ensure Hoosiers can receive enhanced federal benefits. The governor will not impose mask mandates or any other restrictions at this time. And Holcomb says he was stunned and blindsided by recent comments from Indiana's Attorney General. Earlier this month, Todd Rokita said he doesn't believe the state's COVID data, calling it politicized. Here is what Governor said when asked about the statement during yesterday's update.
He could very simply clear it up and say very clearly, one sentence, I believe the numbers that come out of the Indiana State Department of Health. That's it. Those numbers are accurate. If there's any accusation otherwise, legal, that becomes legal very quickly, and he needs to get it to the Inspector General.
Rokita then responded to Holcomb on Twitter, writing, "A lack of global standardization of the data and non-uniform use of criteria is an industry-wide management issue, not an inspector general issue. This isn't about fraud at this point. It's about inaccurate numbers and political agendas causing doubt." Despite surging cases, local bars and restaurants are bracing for big New Year's Eve crowds. And current guidelines in Marion County leave restrictions up to the discretion of each business. Will Howe owns Burnside Inn on Mass Ave. He says he has policies in place for his own staff, but the rest is left to how customers feel.
I don't think you should ever look down on anybody if they wear a mask. That's their own personal, choice. My staff's vaccinated. Most of them are boosted. So we almost feel like the onus is on the customer to how safe they feel.
The CDC recommends wearing masks indoors around large crowds. Happening now, Franciscan Health is introducing new visitation guidelines in some of its hospitals. The health chain says only one visitor will be permitted each day for patients at the facilities in Indianapolis and Mooresville. Franciscan says it will continue screening those visitors for the risk of COVID-19. Visitors 18 and older are still required to wear a mask. The new guidelines went into effect at 7 this morning.